A major shakeup could be coming to Hawaii healthcare. The Hawaii Pacific Health and HMSA announcing plans to create a new parent organization aimed at lowering cost and changing how care is delivered statewide. But it's not a done deal, and there are still big questions. Kimber Collins gives us a closer look at what this proposal would do and the concerns already being raised.
Hawaii Pacific Health and HMSA say Hawaii's healthcare system has become too expensive and unsustainable for families, workers, and providers. They point to rising costs, staffing shortages, and administrative duplication, saying a new approach is needed.
When I think about healthcare in our state, while it's not the single largest contributor to affordability in Hawaii, it's certainly in the top 3 to 4. And as someone who's an insider in the industry, I'm frankly quite concerned. I'm worried about its long-term sustainability.
Under a new proposal, HMSA and Hawaii Pacific Health would form a new nonprofit parent organization called One Health Hawaii. Both systems would continue operating independently, but align under shared quality standards and care goals. A major change would be how care is paid for. Leaders say the goal is to better health results, not more appointments.
So the days of a transactional relationship where you have a visit, you get paid this amount of money for that visit, we want that to be over. We want it to be outcome-based, like you generate value for this patient for health care, then you will get paid.
But reaction has been mixed. At the Queens Medical Center, leadership opposes the proposal, stating they support affordability efforts, but that this move would put more of a strain on their system.
I think the worry is that if more of the commercial patients start to move to the new company, then physicians that we're recruiting or physicians that are independent, they're going to side or want to align more with the new company opposed to all the other entities here, or not be able to get into private practice.
Nurses also raising concerns, saying any restructuring must protect staffing levels and patient care.
We are concerned with this HMSA merger just because we want, a lot more transparency. We want to understand, what it's about. So we want to make sure that what's going to be introduced is going to be beneficial for the whole community.
Supporters acknowledge there are still many unanswered questions, like which providers will opt into this open system, how outcomes will be measured, and how quickly costs could change. But this plan still has a long road ahead. The proposal must still be reviewed by state and federal regulators, including the Attorney General, a process expected to take months to more than a year. Information and updates are posted at healthierhawaiitogether.com. Kimber Collins, Island News.